The class is Clinical Fitness Evaluations and Techniques. It serves as a capstone class for the exercise science undergraduate program, and as one of the end of semester projects, the students are asked to select a research topic related to exercise and chronic disease. It's a pretty open-ended question, and so some examples are osteoporosis, exercise effects on depression and mental health, aging and exercise. And so with that, our students learn how to research and dive into the literature for peer-reviewed articles and scientific literature of research studies that have been done in any of those topic areas. They learn how to search databases, use the library systems here at KU and those available on the internet. They have to generate their own thoughts. They provide summary of all the research articles that they read, and then create a big literature review. And then they take that literature review and they shrink it down into a poster and present it to their class, and then here as a group project where they have the opportunity to display professionalism. And this is very similar to what our students would see if they go to a professional conference or if they're engaging with other professionals in the field. So it gives them good presentation experience, being able to communicate their thoughts and critical thinking skills. It's a project I really enjoy. We've been doing it for a long time, and I think the students get a lot out of it.
I chose my project over osteoporosis. I did a little bit more of a preventative route, and then after diagnosis, what to do after that diagnosis is found. So on the preventative route, it's really important with young kids to start with resistance training, proper nutrition, ultimately just increasing bone health and carrying that into your adult years. After being diagnosed, it's really important to continue exercise. Stuff like doing weight-bearing exercises and resistance training is going to be the most beneficial in increasing overall strength, posture, and balance. The problem with osteoporosis is a lot of people become very weak because their bones are constantly breaking down. So what you have to do is prevent fractures, because those patients can't fully have their bones heal the way that they would want to. So incorporating exercise ultimately helps prevent those fractures from happening. In this graphic, you'll see that exercise helps increase things like muscle strength, balance, mobility, function, while decreasing stuff like diabetes symptoms and arthritis symptoms, ultimately decreasing fall risk, increasing bone geometry, and decreasing fractures. It's also been found that medications do help these symptoms, but it's not as good as it would be unless it was paired with exercise.
And my poster was on the effects of exercise on fibromyalgia, which is a condition that affects 2 to 4% of the population, mainly middle-aged white women. And my main research was to see what type of exercise really helped alleviate and maintain those symptoms, because this is a condition that isn't curable, so it's more so needed to maintain it. So I looked at flexibility training, aerobic exercise, strength training, and found that flexibility training, while it did help alleviate those physical symptoms, which include pain throughout the body, tender points, a lack of sleep quality, and even fatigue, it also had mental health impacts, so there was an increase in depression and anxiety. And again, flexibility mainly only helped alleviate those mental health aspects long term, but aerobic exercise and strength training, while not significantly different to each other, they did help significantly alleviate all of the symptoms compared to flexibility training. And then I also looked at exercise dosage, which again, it's whether you exercise more or less throughout your lifestyle. So you can see there's little dots over here and little diamonds, so there's not much of a difference between all of them, and those represent that low compliance and high compliance, which we can see that there's not really a difference between how compliant you are to your exercise routine. As long as you're exercising, those symptoms will be maintained and treated. But again, mainly on top of exercise, educating oneself with the condition, and some people do take medication for it, will help them, but overall, exercise is a really good way to maintain that.
What I did my topic on was how exercise and diet can reduce your chance of having cancer. And so, the group, I found out that exercise and diet are both very important in your life. And so looking at exercise mainly, so exercising lowers your hormones such as insulin and estrogen, which are two main factors of having cancer. And so the recommended time for exercise every week is about 150 to 300 minutes. And by exercising only 150 to 300 minutes every week, you can reduce your chance of having cancer by 20 to 30%. I thought this was pretty amazing since, exercising 150 doesn't really sound like that much. It could be 2-3 days out of the week. Moving down to diet, so a combination of a diet switch in fruits, vegetables, whole grains, and lean proteins are essential in reducing your chance of having cancer. The reason why is because they provide essential antioxidants and nutrients that protect cells from oxidative stress and inflammation, which are also, again, two main factors of cancer. And so looking down at these charts that I had made, you can see moderate to vigorous exercise can move from, as I said, 20 to 30% reduction. And then on the diet side, the most important is high fiber, which can reduce your chance of having cancer by 20%. Then moving down, low processed meats about 18%. And then plant-based diets is about 14% reduction. And so my conclusion was I just would recommend everybody to try to exercise as much as they can, try to get at least 150 minutes in to get that 20 to 30% reduction of having cancer. And then for my clinical, I would just, tomatoes, onions, mushrooms, nuts, walnuts, almonds are all very important in your reduction. They all have high fiber and are very good for the reduction. And so just a combination of all those things can really change your life and help you reduce the chance of cancer.
My poster is about Achilles tendinopathies and tears, more specifically about tears, really. What I first want to show you about is the instances of injuries in athletes and how it affects them in their careers. Athletes tend to have gone through Achilles tendon tears, tend to have a difficult time returning back to sport. In this study, where you can see the ability of NBA athletes to recover to their sports, actually only about 60% of them return to their sports, where 40% of them actually retire post injury. This is important to know because we want to be able to detect these injuries and prevent them so that they don't end up in the situation of not being able to return to sport and ending their career. So what is important about this figure down here is that this is a way to effectively measure Achilles tendon stiffness in the field, and this allows people to be able to, or researchers to be able to tell the likelihood of an athlete to injure themselves beforehand. So likely they could take precaution, either rest or go through a protocol to recover before injuring themselves. Lastly, this picture is important specifically because Achilles tendon tears are important to be recovered because most of the time athletes aren't able to fully recover from an Achilles tendon tear even after going through physical therapy. So understanding the lengthening of an Achilles tendon during recovery is extremely important because it could be another precursor to a repeated injury post the repair.
All right, so I did my poster on coronary artery disease, also known as CAD or heart disease, and its relationship with exercise. So I found out that coronary artery disease is the leading cause of deaths worldwide, which is why it's important to prevent the risk of this disease from happening and damaging bodies over the long-term period. Some factors of this disease are diabetes, smoking, obesity, and just overall stress. So early on, researchers emphasized that traditionally these forms of methods to prevent these diseases are using like beta blockers, nitrates, and calcium antagonists as like pharmaceutical treatments. to begin with. The more modern day approach is using exercise-based cardiac rehabilitation, which can be paired with the main methods of PCI or percutaneous coronary interventions, which is pretty much just heart disease surgery. And the deltas of that, or con, is that it's like expensive. You have to go to the hospital regularly compared to an exercise-based cardiac rehabilitation program where you don't have to go as regularly. You follow up, do your workouts, and follow up every 6 months from there. And then also another study is telemonitor studies where they take statistics from your smartphone and you take blood glucose levels, lipid levels, and then this also supported VO2 peak levels as well as exercise compliance in patients in China. And more ways outside of this are also in the works, as this disease kills a lot of people every single year for about 80 years, which is kind of crazy that it's still the #1 ongoing cause of mortality. And randomized controls are done with exercise, which is experimenting with exercise and comparing it with people who do not do the exercise within these programs. So my first study was doing the cardiac rehabilitation, and as I said earlier, they follow up 6 months using meta-analytic methods, which can look like aerobic training, which can consist of like swimming, cycling, walking, any form of cardio. And then short-term studies show that reduction in all-cause mortality is pretty significantly reduced. And then long-term studies show that like myocardial infarctions and cardiovascular mortality is reduced significantly. So after 3 years, if the patient is consistent with their program, then the more beneficial it is long-term, and the healthier they can get with treating this disease. In terms of the smartphone method is they take about 106 patients, about 5 drop out from each category, and they do about 48 patients, 1 with a smartphone rehabilitation, 1 without it. And it's found that the ones with the smartphones taking the exercise tolerance statistics and echocardiologic statistics, those patients are, they feel better more significantly after 6 months to a year compared to the patients who don't have that kind of access to the treatment. So, yeah, overall my findings are that these exercise-based programs are not used enough, as middle and low income countries aren't really as aware as they can be. And I think just spreading the word out can improve VO2 peak levels, exercise compliance, and enhancements around the world globally with coronary artery disease, and prevent a lot of deaths that can occur. The main benefits are the life qualities will improve as the cost effectiveness does. So it's cheap, it's accessible, and it's routine based. So you don't get like any random checkups. It's consistent every 6 months, and patients just work on their own will with their treatment programs with their doctors.
I conducted my research on the effects of exercise on rheumatoid arthritis. Rheumatoid arthritis is a chronic autoimmune disease that causes inflammation and pain, typically in the joints. It really affects people ages 65 and up, and it especially affects women. So the purpose of this study and the methods that I used were to analyze different types of experiments that focused on the different types of exercise interventions in rheumatoid arthritis populations. So the first one that I looked at focused on aquatic exercise, specifically in women, So 100 women were separated into 3 different groups that focused on either water-based, land-based exercise, and then the control group completed no exercise. And at the end of the study, it was determined that there was no significant difference in body composition. However, the water-based group had a significant improvement in disease activity and functional capacity. And they also had less adverse effects, such as pain, than the other 2 groups did. And then I also looked at aerobic and resistance exercises. And in this study, 74 patients ages 65 to 75 participated, and they took assessments at baseline, 20 weeks, and then at 52 weeks to look at the more longitudinal effects as well. And in this one, it was determined that there weren't any differences in the health assessment questionnaire specifically focusing on disability. However, the main difference that I focused on was in what's known as PGIC, or the patient's global impression of change, which is what's shown in these 2 graphs here. So this first one is the PGIC at 20 weeks, and then the second one is at 52 weeks. And so the white bar is the intervention group, and the black is the control group. So essentially what PGIC measures is how different or how changed the patients themselves feel. So as we can see here, most of the intervention group, or the exercise group, at 20 weeks reported that they were much improved or very much improved. And then even at 52 weeks, they were either minimally improved or better. And we can even see that the control group as well reported that they felt improved, more so than not improved. So essentially what we can take away from that is any type of exercise can make a patient feel better. Even if you aren't seeing like qualitative results or numerical results, like how the patient feels, in my mind, is really what's most important. So that's a really important takeaway here, and how aerobic and resistance exercise can be beneficial. The final thing that I looked at was mechanisms and implementation of this model. So essentially, exercise is helpful because it can reduce inflammation, partially through reducing body composition. If you have less weight, there's less stress on your joints, and therefore can decrease the pain that's related to rheumatoid arthritis. However, there's a couple barriers to providing like an actual implementation model, and a lot of it has to do with just misunderstanding or misinformation about what the disease actually is, and how exercise can affect it. So ways that we can change that are by encouraging collaboration between rheumatoid arthritis specialists and exercise physiologists. But essentially, as in all things, exercise is beneficial, and different exercise can be beneficial for different people. And it's really, really important to keep the patient at the center and to make sure that their program matches them and is so we can maximize the benefit that they reap.